In this video, we will focus on when to perform CPR, what a cycle of CPR is, understand how it's recommended in those who are unresponsive, and proper hand positioning, chest compressions, and rescue breaths. CPR is a life-saving technique useful in many emergencies, including a heart attack or near drowning, in which someone's breathing or heartbeat has stopped. The American Heart Association recommends that everyone, untrained bystanders and medical personnel alike, begin CPR with chest compressions. It's far better to do something than to do nothing at all if you're fearful that your knowledge or abilities aren't 100% complete. Remember, the difference between you doing something and doing nothing could be someone's life. As soon as an emergency arises, you begin by calling 911 and placing your phone on speaker. You will begin CPR if the victim's pulse has slowed or has stopped, if the person shows no signs of life, or when they are unconscious, unresponsive, or not breathing. When performing chest compressions, proper hand placement is very important. To locate the correct hand position, place 2 fingers at the sternum, then put the heel of your other hand next to your fingers. When performing chest compressions, proper hand placement is very important. Again, your elbow should not bend, and the depths of compression should be approximately 2 inches and no more than 2.4 inches. Your rate of compression is 1 to 2 compressions every second. And your hand position should be interlocking your hands. After 30 compressions, open the airway using the head tilt chin lift method. You lock the nose and give 2 slow breaths. Give the first rescue breath lasting 1 second and watch to see if the chest rises. If it does rise, give the second breath. If the chest doesn't rise, repeat the head tilt chin lift maneuver and then give the second breath. You will then repeat 30 chest compressions. 30 chest compressions followed by 2 rescue breaths is considered 1 cycle. The depth of your 30 compressions is 2 to 2.4 inches, and what you're trying to do is generate blood flow to the brain. You will continue conducting CPR cycles until first responders arrive. CPR comprises of cycles of chest compressions and rescue breaths in a ratio of 30 compressions to 2 rescue breaths. 1 cycle of CPR is 1 round of 30 compressions and 2 rescue breaths. Again, it's critical to have your cell phone on speaker mode and count your compressions for first responders. Continue conducting cycles of CPR until first responders arrive, and ensure proper technique throughout the process. In the next video, the example will demonstrate breathing with a barrier device.
Safety, checking the person, and providing care.
Are you okay? Call 911. He's unconscious. 1 1,000, 2 1,000, 3 1,000, 4 1,000, 5 1,000, 6 1,000, 7 1,000, 8 1,000, 9 1,000, 10 1,000. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10 and 11 and 12 and 13 and 14 and 15 and 16 and 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. 2, 3, and 4, and 5, and 6, and 7, 8, 9, 10, 12, 13, 14, 15, 16, 17, 18, 19, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Do not stop CPR except in one of these situations. You notice an obvious sign of life. An automated external defibrillator or AED is ready to use. Another trained responder or EMS personnel take over. You are too exhausted to continue. Or the scene becomes unsafe.
CPR alone is unlikely to restart the heart. Its main purpose is to restore partial flow of oxygenated blood to the brain and the heart. The objective is to delay tissue death and to extend the brief window of opportunity for successful resuscitation without permanent brain damage. Administration of an electric shock to the subject's heart, termed defibrillation, is usually needed in order to restore a viable or perfusing heart rhythm. Utilize an AED if it is available to you. Before practicing at home, it's critical to know the rubric. There's a total possible point total of 15 points. It's critical to check scene safety, check responsiveness of the victim and breathing, activate the emergency response system, conduct proper chest compressions, and if feasible, when you're creating your video, to embed rescue breaths as a simulation. First, check scene safety. Check your responsiveness by tapping on the victim and shouting, "Are you okay? Are you okay?" Activate the emergency response system by calling 911 and instructing someone to get an AED. The chest compressions, there should be 30 compressions where students have proper hand placement in the middle of the chest, in between the nipples, interlocking the fingers and using the heel of the hand to compress upon the victim's chest with the elbow straight. Moreover, for rescue breaths, perform 2 rescue breaths lasting 2 seconds, allowing the chest to rise with each breath. Prior to performing the rescue breaths, it's critical to perform the head tilt, chin lift correctly. Materials that you will need are a full roll of toilet paper, an extra large t-shirt, and a towel to practice hands-only CPR. What you will need to do is fold your towel in half, place it on the floor, and insert the t-shirt through the toilet paper roll. Once you've inserted the t-shirt through the toilet paper roll, place it on the towel and fold the towel over. This will give you about a 2-inch recoil when you begin to conduct compressions. Your video will look similar to this example. Now what you'll do, you'll insert your t-shirt through the toilet paper roll and fold over the towel over the toilet paper roll and the t-shirt, which should give a strong recoil for the compressions that you will be demonstrating. Now conduct 30 compressions and submit a video of your efforts. In this video, we focused on when to perform CPR, what a cycle of CPR is. Now we understand when it's recommended to conduct CPR. We also focus on proper hand positioning, chest compressions, and rescue breaths.